Our second presentation on phages is being presented by a patient, Christopher Shaffer. Chris is a retired high school principal and special education and music teacher of 45 years. He was thrust into an infection crisis when he was diagnosed with an E. coli infection, which was resistant to extended spectrum beta lactamase antibiotics. Rather than continue on failing and a risky course of treatment, Chris went alone to find a cure overseas with phage therapy. This presentation is his story. Chris, the floor is yours.
Thank you for inviting me to speak. I want to tell you today about my experience as a patient. So I'm sure that every patient experience is unique, but there are a lot of commonalities too. When you have a bacterial infection, which is antimicrobial resistant, that's what I had. Ultimately was E. coli with ESBL that would not respond to antibiotics. And that's a picture of what it was like when I had the infection. I was in bed a lot and I was sick a lot with a high temperature. And why am I here? Because I want to make life better and ease pain and suffering and save lives using phage. That's ultimately why I'm doing this, why I'm speaking today, is because I discovered that phage does save lives, and it saved my life. And so this is my life before E. coli with ESBL. I grew up in the Midwest, in Springfield, Ohio. We all have heard about that city, right? They do not eat cats and dogs there. But I had a really normal childhood. You can see my picture of I went to the gym all the time, worked out all the time. I was a very healthy guy. So this can happen to anybody. It doesn't mean you're sick to begin with. I was perfectly healthy. And the picture at the bottom there, me and Barack Obama. And the picture on the bottom right, me as a kid, you can see that's an ornery little kid, right? That's me today still. I can be pretty ornery and don't say no to me. And that's kind of really where I ended up in phage, was don't say no to me. I know that I'm going to make this work. And I ultimately did. This is my life with E. coli, with ESBL, lots of hospital visits, lots of NG tubes. And I think this is where the infection actually happened, was this instance when I had a blockage and they put the NG tube down into my stomach. And I don't believe they followed protocol. They laid the NG tube right on the sink. It wasn't in a package when they came into my room. Of course, I didn't know any of this at the time. I was a former music teacher and a high school principal with no background whatsoever in biology or medicine. I knew absolutely nothing about protocol in hospitals and what that should be like. So when I come down with this E. coli, I initially thought it was COVID. It was in the height of the pandemic. In 2018, I had a diverticulitis episode, which resulted in a perforated colon. And that's really what began this whole episode. I had surgery and healed from that, but then a hernia, of course, appeared over the incision, and I had to have that fixed. It went all sideways. That's what resulted in these multiple hospitalizations with NG tubes, and that's what brought me to E. coli, I believe, was that when the hospital didn't follow protocol in making sure that the NG tube was sanitary when it went into my stomach. So I thought I had COVID. We're right in the middle of the COVID pandemic. And I came down with high fever, body aches, chills, coughing, sneezing, you name it, I had it. It was really bad. So I didn't take the first COVID test. I ran down to the, drug myself down, literally, to the airport, took my PCR test. Takes about a day or two to get those results. So I go back home, climb back in bed, and hope this thing passes. Well, it's not passing. And the next day, later in the day, I noticed my hands started to go numb. That's when I really thought, okay, I've got a big problem here. So I called my doctor. He actually answered, and he always does. My physician, my primary care, always answers the phone. He's really, really good about that. And he started asking me about my symptoms. He said, do you have any other symptoms that we're not hearing about? And I said, well, I have been having a difficult time peeing. I can't go urinate. And he said, okay, that's bad. And he said, tell me more about that. And I said, well, my urine smells really bad. It's really very foul. And he said, you need to get off the phone now and get yourself to the ER immediately. He said, it sounds to me like you have bacterial prostatitis and you could become septic and you need to get there now. And that's exactly what I did. I hung up the phone. I couldn't at that point drive. My hands were numb. I could tell I was getting sicker by the minute. I called the ambulance and they got me to the ER. It was just coincidentally before that, a few days before that, I had my routine lab work, yearly lab work, blood tests done, urine culture. And about the time I got to the hospital, all those test results started coming back. And I could see those in my chart. And I could see that I did not have COVID. I thought, okay, I do have bacterial prostatitis, or at least that's probably what it is. I still didn't know anything about it then. And then all my other tests came back. And yeah, I did have the cultures, and the results of the urine test revealed E. coli with ESBL. And of course, didn't know what ESBL meant. And what I later found was that's about as bad as it can get. So the hospital there in the emergency room, they filled me full of oral antibiotics and IV antibiotics. And I thought, well, I'll be new again, antibiotics, I'll be fine. As soon as I'm done with them, everything's going to be great, right? That's what I thought. And again, didn't know any better. And in fact, I did start feeling better. I got better. And for about 6 weeks, I was feeling pretty good. I was back to the gym working out. This is in the picture here with me, a friend I met later on in the Phage world, Rita Kalin. She's very well connected to the Phage world. Her and I got together at some point to have conversations, but I got better. But then here 6 weeks later, I'm back in bed with all the same flu symptoms I had before. So I'm trying to figure out, do I have the flu this time, or is this coming back again? And of course, we find out and we do more testing. It's back again. And this started the yo-yo of on again, off again antibiotics for over 2 years. And every time I took antibiotics, they would fail. I took several different kinds of antibiotics, ultimately ended up on Bactrim for the most part, because that was the last one that would actually work for me before the hospitalized IV infusion that they were suggesting I take. But ultimately, I would end up stopping the antibiotics, and it would be just a day before the symptoms reappeared. And then by the end of this episode, near the end of the 2 years that I were on the antibiotics, I would just have symptoms constantly, even on the antibiotics. My CFU counts were over 100,000, even on the antibiotics. And this is where I kind of started to really dig into, what are these sensitivity panels and what do they tell us? And it tells me that the E. coli that I had was resistant to most everything. The Bactrim, it was still sensitive, but it was losing its sensitivity and was becoming resistant. And I knew that because I was just sick all the time. The doctors that I saw, the infectious disease experts, were telling me over and over, your last opportunity is to go into the hospital, and we're going to have to do that. And you're going to have to be there for 3 weeks for this toxic IV antibiotic infusion. And don't get me wrong, I'm all for antibiotics. And when we need them, we have to take them because they do save lives and they are miracle drugs, but they're failing at alarming rates. And this is where I started to become familiar with these terms, because once they told me it was an IV infusion for 3 weeks in the hospital, I asked them, why in the hospital for 3 weeks? Well, because it could kill you. And I said, then why in the world would I do this? Why in the world would I subject myself to IV antibiotics, which you can't even tell whether it's going to cure me or not, but you can tell me it might kill me. So I decided against that. And I learned that the antibiotics are not going to work. Even if I could get the antibiotics to my prostate, the prostate is such a dense organ, it's not going to get in a concentration level high enough to cure any bacterial infection. And then as I started to do my research, I kicked it into high gear, and I became nothing but a machine working on finding a cure for this antibiotic resistant infection that I had. And I learned about the new antagonist that I had no idea about. It was biofilm. And once I learned about biofilm, that's when I really understood these antibiotics are never going to poke through this biofilm and get to my prostate and cure this infection. But I had begun to understand about phage, and I knew that they might. 2 years on antibiotics and things are worse. They're not better. And I'm not going into the hospital for a 3-week IV infusion. That's just not going to happen, because I know what it's probably going to do to me, because I'd begun talking to other patients who had done this, and it wasn't working for them. They were having more problems after these IV infusions than they were before the IV infusions, and they just weren't working. So the research takes me to phage, but I'm not confident about phage. Maybe I'm just this American who's hearing about this center over in Tbilisi, Georgia, and maybe they're just going to take my money, right? I don't know anything about phage other than someone's asking me to drink a vial of live virus, and that sounds like a bad idea at that time. But I just kept digging into the research because that seemed to be my only hope. And I met a guy in India named Pranav Johari who had gone through treatment at Aliava, and he told me his story. And I began to start trusting in phage and understanding its power because I learned how they work. There in the head of the phage virus, it's a picture of the phage virus. That's where the DNA is held. And when that phage bumps around it, it lands on a bacterial infection and it will poke through with its little stinger, wiggle its head, and its DNA will go into the bacteria and take over the reproduction processes of the bacteria, multiply in there, burst out, killing the bacteria in the process, sending out thousands more phage to do the same thing. So phage is a self-reproducing virus once it's in the host, and that's why it's such a great medicine. But can you get it here in the United States? Well, here's some of the problems. And where are the phage physicians? I had a fellow heavily involved in the phage world call me just last week for advice on how he can get his best friend's mother phage therapy. And I said, I don't think you can still in the United States. And he found out the hard way. He called every one of the labs. He was turned down by all of them because it's not compassionate use. Where do you begin with that paperwork? And here's a compassionate use navigator for physicians. It's a big process. And then once you get yourself through this compassionate use process, you've got to source your own phage. It's just not out there to hand to somebody. And then who performs sensitivity testing on that phage and your bacterial isolate? That's not easily found in the United States. And we don't really have the people available in the United States to create a great phage cocktail. And then who does the lab work? And remember, you're doing all this from here because you're the one doing it. No one's going to give you any help in this. The hospitals that are providing phage, they're really not accepting patients in the United States. The numbers are staggeringly low. In the past 10 years, we've probably only had, and these are numbers that I've compiled, but from very good sources, I believe the number is probably around 500 patients that have been treated in the past 10 years with phage therapy in the United States with compassionate use. Globally, through that process, about 2,500. The numbers are staggeringly low given the number of people that are dying every day, which is probably around 1,000 every day. And in the past 10 years, we've treated maybe 500 people in the United States. And I'm a sick person. I've got to make all this stuff happen from my bed. It's just not going to happen. And so that's why I decided to fly to Tbilisi, because I knew at this point a lot about Eliava Phage Therapy Institute, and I knew that they could help me. So I start my treatment on June 9th. I was doing 2 cycles with 10-day breaks in between. When I started my treatment, my CFUs were greater than 100,000. I knew the advantages of phage antibiotic synergy. Eliava told me, keep taking this Bactrim for the first cycle. We know that they can work together and these two will be synergistic. Here's all the advantages to phage therapy. It has no known side effects. It degrades biofilms. It has a high specificity. It's versatile. It's natural. It doesn't impede the normal flora. It's self-replicating, and it can make antibiotics effective again. That was actually the case in my situation. Levaquin became sensitive again when it wasn't sensitive before. It was resistant. I wasn't on Levaquin at the time, but when we did a sensitivity test later, the doctors were shocked that Levaquin was now sensitive. I said, well, I'm not shocked because that's exactly what phage does. It makes antibiotics effective again. And so halfway through my phage treatment, my CFUs, and I got this CFU count while I was at the Evergreen Phage Therapy Conference in Evergreen. At the same time, I opened up my chart while I was listening to Ben Chan from Yale present his recent study about CFU counts from people on phage therapy. They dropped precipitously. And I opened up my chart, and here's mine down between 10 and 25,000 units. That hadn't happened in 2 years. First time, halfway through the phage therapy treatment, these are my CFU counts. I knew phage was working at that point. So on day 12 of the third cycle of my phage, I get up in the morning and I go into the bathroom to do my bathroom morning routine, just shouted to myself, it's gone. And 2 weeks after I finished that last round, no growth. This is my most recent test. 2 years later, no growth. I'm cured. Thank you very much, Kevin, for giving me the opportunity to speak.